haven't been staying in there too long, have you? Okay, good. I apologize. I was just trying to make sure I had everything ready, just in case, you know. Alright, so do you have an appointment, or is this like a random walk-in? Okay. Okay. Alright, perfect. Alright, so name. Alright, birthday. Okay, good. Phone number. Alright, perfect. It does look like we have everything here. So, what brings you in today? I see. Mental health. Okay. And how long ago did that start? A month. Okay. Alright. Let's see. Was it anything particular that might have brought it on? Okay. You lost a job recently. Oh, yeah. I get it. It sucks, definitely, I know. Alright, so job. Alright, so about a month, and because you lost a job, have you been able to maybe find anything? Like how long ago did you lose it? Okay, a month ago. Okay. So, okay. Yeah, I know. It's hard, isn't it? Yeah, I get it. You know, I've had people come in, tell me they've spent like what felt like years trying to find something, and nothing ever worked out. I mean, I was that way too, you know, until I found this. Yeah, so I definitely get it. Yeah. So, it is Mental Health Awareness Month, if you didn't know. Yeah. May is Mental Health Awareness Month. Yeah, although it technically should be every month, every day, year. Yeah. I know. I mean, of course, not just 1 month where we maybe talk about it. So, since you're going through this, I sense there are probably times when you might not want to get out of bed. Yeah, I get it. I've definitely been there numerous times. You know, even doing this, you still get that way. But what I want you to remember is that we are human. We go through emotions, you know. And it is okay to not be okay. Even when, you know, we might feel okay maybe 1 minute, you might not the next. You get what I'm saying? You know, I know there's gonna be those bad days where, again, you don't want to get out of bed. You maybe go to bed that previous night and you have a whole checklist of things that you want to do. But you wake up the next morning and you literally have no motivation to do it. I've definitely been there. Yeah. I know. But again, it is okay to not be okay. You know, no matter what anyone else out there might tell you. I mean, I had a last patient of mine, I think just yesterday, told me that they got had to sit there for a minute and try to process that. And I thought to myself, what makes a difference? What people got going on outside of maybe social media or something? Again, we're human. We are all going through something. You can have all the money in the world and still have those days where you are sad, unmotivated, again, not wanting to do anything. You might go through a day where you don't even want to talk about it. And trust me, I've been there. Many of my patients have been there too. I'm sure you might get that way too. Right? Yeah. But hopefully, we all have that one person in our lives. That one person, no matter who it is. Maybe family member, a friend, maybe like a friend you've known for quite some time. Maybe a neighbor, coworker, someone out there who you can go to an event. And I know that you lost your job a month ago, but I hope maybe that even if you've gone through this before, you had that person there who you can, easily talk to, or just having a bad day in general. Maybe you had that one customer who just said something that just triggered. Maybe on your lunch break or something, Maybe you vented to them. I don't know. But I hope, especially now since you're going through this, that you still have that person. Yeah. Because they might end up being important, I hope that their inbox, maybe on social media somewhere, or just text message, I hope that it's open. Now, is there anything that you have maybe recently started getting into where you realized, hey, this helps? Have you been able to find anything? Yeah. Okay. No, I get it. So, even if you're not good at it, I recommend drawing. Or easily go somewhere and get a coloring book. Maybe some markers, color pencils, crayons, whatever. Maybe sit down somewhere. If you have a table, you can use some sort of tray, whatever it might be, and sit there and, color. Or find something easy that you can easily draw. Even if you're not good at it the first time, it's fine. We're all not perfect when we try something the first time, I mean, that's how I was. I have been drawing since 2013. And of course, I was definitely not the most perfect at it. No, I'm still not. But, that doesn't mean you can't still practice. Start small. Again, just something really easy. right? Especially when you clean. Yeah, trust me, I do that too. And you might realize that it helps. You know, maybe that one particular song comes on from your favorite artist or band, and you're just like, yeah, this is what does it. I recommend that every day. You know, maybe even before going to bed. Or might I add, watching ASMR. Do you happen to watch it at all? Sometimes. Okay. No, it's fine. So, if you ever maybe just get those bad days, you know, and you're still kind of feeling it towards bedtime, knowing maybe you might not be able to fall asleep right away, sit there on maybe your phone, tablet, whatever it is you got, go to YouTube and type something in. Might I recommend Diabetic Beauty ASMR? I hear she's pretty good. Just saying. I'm just a messenger. And definitely subscribe. I promise you it's worth it. And if you happen to have TikTok, you can follow her over there too. Yeah. The links will be in her description, you know, so. Okay, good. I've been looking for you. Okay. So yeah, just something simple like that. You know, where you can easily just let loose and relax. You know, let all of your troubles melt away. Even if it's just for like 10 minutes or an hour. Just keep it up. You know, get a routine going. And just know that even if it doesn't feel like it, it will get better. You know? Again, you're gonna get through those rough patches. But you'll also have some pretty good days. I promise you. And then hopefully you'll find something that you love to do. Hopefully you'll keep it going. You'll be really good at it. You know, you'll find that dream job that you've always wanted. Things will start to look up. Okay, good. Alright, so take my advice. Okay, I hope you got all of that up here. Even though I know there's probably already a lot going on up here already. But, you know. Okay, good. Alright. Well, we'll give it